Hello everyone, I welcome you all on the behalf of Shalby Hospital. I want you to introduce to a new modality at our hospital for acute stroke management. In recent past, in the diagnosis and management of acute stroke, there is a great advancement and a new diagnostic modality for which I want to make some emphasis. As you all know, stroke management is best done by a good stroke unit which comprises of a good infrastructure, and we need a stroke team which comprises a stroke neurologist, a neurosurgeon, neuroradiologist, a neurointensivist and neurorehabilitation. Transcranial Doppler ultrasonography is a non-invasive ultrasound device used to evaluate blood flow velocity in major cerebral blood vessels of the brain on beat-to-beat basis, and it is also known as stethoscope for the brain. I want to tell you something about the advantages of the TCD. As you can see on this slide, it is a bedside method and it is safe, there are no radiation, it is non-invasive, it can be repeated, and it has a low cost and portability. It's a real-time imaging of the intracranial blood vessels. In this slide, you can see that we do the transcranial Doppler ultrasonography by transtemporal window, and it is done by a 2 MHz transcranial Doppler, and it's also you put the probe transducer between the ear and the frontal process of zygomatic bone. Transcranial Doppler has an important role in stroke prevention because it has a predictive nature in the assessment of risk factor of stroke. The primary care physician should consider referring these patients for the following condition for neurovascular assessment. The indication, as you can see on the slide, they are the risk for atherosclerosis, TIA, carotid stenosis, intracranial stenosis, continuous emboli monitoring, vasospasm in subarachnoid hemorrhage, for therapeutic purpose, sonothrombolysis, diagnosis of patent foramen ovale, and to diagnose or confirm brain death. As you can see, one of the indication I have demonstrated on this slide, that is the emboli signal monitoring. And you have seen we have put in the frame on the head, and there is a transducer bilaterally, and it is placed upward and anterior probe angulation. And in the spectral window, you see the bright two emboli hits in the brain of middle cerebral artery. Those are known as high intensity transient signals. For acute therapeutic purpose, we use TCD for sonothrombolysis. As you know, the ultrasound enhances the thrombolysis and increases the transport of the drug, that is TPA, into thrombus, promotes the opening and cleaving of the fibrin polymer, and improves the binding of affinity of TPA to fibrin. And this spectral window for sonothrombolysis, on the top you see pre-TPA condition when there is occlusion in proximal MCA, and subsequently as the time passes, the vessel open up, and below there is a NIH score that's supposed to make for the severity, and the patient was having a very high NIH initially, which has decreased as he improved in his clinical condition and neurosonological. One of the indication for TCD is patent foramen ovale, and this video show the echocardiography on the right side of the figure. And the left side is showing the transcranial Doppler, and you will listen to the high intensity transient signals as we proceed through the video. We can also use transcranial Doppler for confirming or diagnosing brain death, and it has a reverberating flow during that phase you can see in the figure. So my conclusion remark will be TCD has an established clinical value in the diagnostic workup and therapeutics of stroke patient and is suggested as an essential component of the comprehensive stroke center, and we have completed this recently. Thank you very much.